The American Cancer Society estimates that over 96,000 new cases of colon cancer will be diagnosed this year. There are several methods used, including colonoscopies. Today we'll meet Brian, who has had a family history of colon cancer. Watch as he gets tested here on The Younger You.
I'm on top of the world, now I'm living, and the good just gets better, keeps on giving. Not even close to the end, it's just beginning. Life is getting lighter while the days are getting brighter, yeah. And it's a good, I won't even worry anymore. Took all my care, still can kick them all out the door. Go on and try, come and tell me what you're waiting for. Move and keep them going till your life is overflowing, yeah.
Welcome to the show. Today on The Young You, we're talking about colon cancer. March has been a colon cancer awareness month since 2000. It has become a time when thousands of patients, doctors and advocates come together to spread colon cancer awareness. One of the ways they do this is by wearing blue, which I'm wearing today, of course, and we'll not only be talking about colon cancer, we'll also be meeting Brian and watching as he gets a colonoscopy. But first of all, let's chat away to Dr. Red, who'll be discussing colon cancer with me today. Hey, Dr. Red, how are you?
Good, how are you doing?
Okay, I'm great. You know,
good.
Yes,
good.
good.
That's always great.
I wanted to talk to you first of all. We've got a website that we've got this information from. It's coloncanceralliance.org. And this was a questionnaire that we found that everyone can participate in.
Yeah.
So the first question that we found was, do you have a personal or family history of colon cancer?
Yeah, and this is important because if you do, you're 2 to 3 times more likely to have colon cancer.
That's pretty scary.
It is.
So question 2 is, do you have IBD? What is that?
Yeah, this is an important question because if you have irritable bowel disease, this is where your intestinal tract gets inflamed and has problems, either due to poor food sources or other biochemical and physiological imbalances. This is important because if you do, you're 5 times more likely to have colon cancer than if you don't.
But isn't it just a word thrown around now that's out there? Everyone just says, oh, I've got IBD.
Unfortunately, because of our really high stress lives that we have and our really stinky diets, it increases irritable bowel syndrome too. So it's going to be increasing immensely over the last 10 years. But at the same point, there's probably lots of people that have it, and unfortunately, it's going to increase the risk for colon cancer.
Okay, how do you fix it?
There's lots of things that you can do. You have to identify what foods you're intolerant to.
Okay.
You got to avoid certain stressors like cortisol defects and certain things if you can really minimize the amount of stress that you have in your life, which sometimes is obviously difficult, but you can. There's all sorts of things that you can do as far as a blood chemistry standpoint, where if you can go and analyze certain things and look at do you have good flora, good bacteria, and other things in the intestinal tract, that would be important too.
Also, it says another one here, UC.
Yeah, ulcerative colitis. That's an autoimmune disease to the intestinal tract, typically the colon. And that's basically where your immune system is attacking the intestinal tract. That's not as well researched as IBD, but it is researched where it is increasing your risk to have that, along with celiac disease and Crohn's disease as well.
Why is it important regarding diet?
If we're having a diet that's high in fat intake and also high in glucose or sugar, then it increases our risk as well. We're seeing that just simply minimizing the amount of fat intake and having a well-balanced diet where you're eating a diet full of vegetables and fruits and lean meats and things like that, you're going to be having a decreased risk of having colon cancer.
Dr. Red, does high fat contribute to colon cancer?
Yeah, it does. They're seeing that the high fat intake does increase that. If we're eating a high fat diet, that will increase inflammation throughout our body. That will also cause intestinal inflammation as well. It increases what's called bacterial overgrowth of the small bowels. The bowels just aren't functioning well. We don't have as good as gut motility, where our food isn't like going through the intestinal tract and absorbing like it should. And when that occurs, we end up having problems, and the research is showing that it does increase our risk for colon cancer.
But I have to say to you that a lot of people out there, and I'm sure they will agree with me, they think they're eating a good diet.
And you know what? In America now, the quality of our diet is just rapidly decreasing, where they're trying to increase the quantity. So unfortunately, it's just going to get worse and worse and worse. What we think is a good diet today is probably not a good diet. There's far better ways to eat to maintain a healthy lifestyle and feel good.
One of the obvious ones, which is what I was reading, is do you smoke?
Yeah.
Like seriously?
Yeah.
That's a bit crazy.
Well, you know, you're thinking of that though, is you link smoking and things like that to lung cancer and stuff like that. But they're actually seeing research.
Think of colon.
No, yeah.
Okay.
And you're now actually seeing research showing that it does increase your chance for colon cancer as well.
Okay. So the next one is, when is your birthday? What's all that about?
90% of people that have colon cancer, it starts after the age of 50.
Okay.
And so if you're over the age of 50, it's crucial that you are able to screen this out.
So what about if we go in for a screening before then? If you obviously have a family history.
Yeah, if you have a family history, you're going to want to, because you're 2 to 3 times more likely to have this.
Okay. Well, here's an interesting one, which I'm not a big fan of, to be honest with you. Do you exercise at least 30 minutes a day?
Yeah.
I know you're supposed to, but not everyone does.
This is a common question for pretty much every health
issue in the
aspect
world
of our life,
yes,
right?
Exactly.
Are we exercising? If we have sedentary lifestyles, that increases our chance for any type of cancer. And they're now linking it to colon cancer as well. So working out even 30 minutes a day is crucial.
So look, not everyone has the opportunity to go to the gym. Can they just do some like push-ups at home or some exercises from a chair as such?
Yeah, I mean, look,
go for a walk 30 minutes.
There's lots of things that you can do. You could jump rope for 5 to 10 minutes. Do a high intensity workout 5 to 10 minutes a day.
Okay.
You can also do wall squats till you fatigue, and push-ups till you fatigue, and sit-ups till you fatigue. You could develop a 20-minute workout that would be awesome for you, just doing it at your home.
Well, if you head over to our website at theyoungeryou.tv, we're going to put some information up there on some exercises that you can do at home. But before Brian goes to the hospital to get his colonoscopy, he has to have a drink. So let's head over to the kitchen to see what he needs to do. Well, before we get to this, Dr. Maxwell will be performing Brian's colonoscopy. Here's a list of things that Brian had to do before his exam. Let's take a quick look at just a few of them.
So 3 days before your colonoscopy, we have patients stop eating whole pieces of fiber, so seeds and nuts, beans, corn, anything like that that could end up as debris when we're going to do the procedure a couple days later and could interfere with visualization. 2 days before the procedure, we have people eat a normal dinner and then at about 7 p.m. start a clear liquid diet that they'll continue until they have their colonoscopy. Anything from broth, coffee counts, soda, clear juices like apple juice, Gatorade. And then the day before the procedure, we have people on a clear liquid diet all day. And then they usually start their prep with some laxative tablets in the afternoon and drinking Miralax and Gatorade in the evening.
Thanks, Dr. Maxwell. Dr. Red, let's mix up. What are we going to do?
Yeah, I'll take this whole thing.
Are you serious? Yes. You put it in here?
The whole thing in
so
there.
Just quickly, Brian actually had to do this at 5 p.m. Okay, the night before.
Yeah.
And because his operation was at 1 p.m. the following day.
Yep.
We've just put a whole... I'm sorry. This is another reason why I don't want to do it, because you were saying that you'd be running.
Yeah.
But we've been told that isn't the case.
Yes, so here's the thing. You're gonna pour the whole thing of Gatorade, and Dr. Maxwell just says something with an increased amount of electrolytes in there. So he likes to have sports drinks.
Oh, okay.
So 64 ounces
why
of
is
Gatorade.
That?
Just to help the electrolyte balance so the patient doesn't have symptoms and stuff going into it.
So this is what Brian mixed up, and I'm sorry, Brian, this is what you drank. It's an awful lot. How often should we be drinking this before the operation?
You're going to drink 8 ounces every 10 to 15 minutes until it's completely gone.
Have you drunk this before?
No, I have not.
Do you think that's mixed in?
I think it's mixed. I think it's pretty good.
So I really think it's most important that when you're testing these sorts of things, that one has a taste. I can't believe, don't drink it all. Oh, that's a bit of a problem. I don't want you running to the bathroom.
Yeah, there you
really?
go.
Oh, no, I'm a man. I can't drink it.
Oh, I got it. No,
oh, you got to go?
Yeah.
Okay, we'll be right back after this short break. Stay tuned after the break as I sit with Brian and talk about his family history of colon cancer and how it has affected his life. We will also watch as he has the procedure that so many people are afraid of, a colonoscopy. The following footage contains actual medical procedures. It may be too graphic for some viewers. So Brian, tell me, you had a colonoscopy quite a few years ago. Tell me about that.
Well, I was on vacation in Hawaii. We had some weird health issues, having extreme abdominal pain, stuff like that, just kept getting worse. And they kind of did a rush colonoscopy because they thought it might be Crohn's disease. But I came out with a clean bill of health, and that kind of ended up as a mystery. We don't know why I was having
those pains.
The abdominal pains.
What were the pains? Tell me, explain the feeling.
Like unbelievable cramps in my stomach and stuff like that. And then I would also have to go to the bathroom a lot and quickly.
Were you thinking, oh my gosh, I've got bowel cancer.
Right.
There's something wrong with me.
Well, when they said Crohn's disease, I immediately Googled it like everyone does. And it's actually pretty serious stuff. It's a life-changing disease. And so I was nervous, sleepless nights, not knowing what they were going to find and stuff like that. But certainly after it, I realized that it was so much easier than I thought it was going to be.
Do you have any family history of bowel or prostate issues?
My grandma died of colon cancer.
Okay, and how old was she when she died?
She was in her mid-50s.
Wow.
Very.
So when you had those pains and they said colonoscopy, ding dong,
Yeah.
that thought went through your head.
Right, and I had been pre-warned because I have colon cancer in my family history that probably when I was in my mid-30s I was going to have one, and then probably by the time I was 40, I would probably have to have it more often than a person with no colon cancer history.
So we're here at the Wasatch Endoscopy Center on St. Mark's campus. We don't get to see this often, but we're going to go in and see Brian's colonoscopy. We're going to go in and meet Dr. Maxwell and get started. Come follow me. Hey, how you doing?
Good. Welcome.
Good. Okay, so what's the procedure like for Brian today?
In a minute, Brian's going to turn on his left, and he's going to pull his legs up kind of like he's sitting in a chair. We're going to talk to him, make sure he's comfortable, and then we're going to give him medicine in his IV that's going to make him go mostly to sleep. This is not general anesthesia.
Yeah.
You breathe on your own during the procedure, but he'll be very comfortable.
Good, good. What type of equipment do you use?
These are new high-def scopes that have become kind of the industry standard over the last, maybe over the last 5 years, and they're fantastic. The procedure itself involves putting the scope in his bottom and going around his colon from one end to the other, about like that, inflating with air and coming back out, inspecting the mucosa, looking for abnormalities. Colon cancer screening, I would say, is a little bit like doing a skin exam, but on the inside, and looking for moles, and removing the ones that are funny. So a polyp is an abnormal growth on the inside of the colon. Almost all of them we can remove right through the scope and pull out if we find them.
And besides polyps, what else are you looking for during this procedure?
So mostly it's going to be polyps. Now, every now and then we find cancer, a polyp that has progressed past the polyp stage to cancer. We're hoping, obviously, not to find that. We'd much rather find polyps and cut them out so they can't become cancer. We also do colonoscopy looking for inflammatory bowel disease like ulcerative colitis or Crohn's disease, or for diverticular disease, following up after diverticulitis or for pain or otherwise.
Yeah, definitely.
The best thing about a colonoscopy is that they're giving you most of your results right away. Unless they have to send something off to a lab.
Wow, that quick. All right.
Now, again, I'm not a doctor, so I'm sure there might be some things that they pull off and they're like, we're not sure if it's cancer or if it's benign.
Yeah.
But,
Brian, you ready to get sedated here?
I am, thanks.
Okay, we'll leave the rest up to Dr. Maxwell.
Very good.
Alrighty.
We'll take good care of you, Brian.
Thanks.
All right, can we start sedating Barb? This is the part that makes people not want to do colonoscopy. Nobody likes having a doctor they barely know put instruments in their bottom. He won't remember any of this. He'll be very, very comfortable the whole time. Okay, let's get started. So starting the exam, this is the beginning of Brian's rectum on the way out. So I'm adding air and water to Brian's colon.
So why water and air?
So I add water both to clean and to lubricate the scope. And then the air, I add the air so that I can see the inside of the colon.
As we're sitting here, I'm thinking to myself, I don't know how I will cope with the thought of something going wrong.
if there is something wrong and you don't do something about it, in a year it'd be twice as likely you wouldn't survive. In 2 more years, you'd probably be 4 times more likely to not survive. So putting it off doesn't make any sense. You're just more likely to die from it.
And so the first part, we're just getting to the other side of the colon. Last part is really the exam where we're trying to exit, is where we really find polyps and abnormalities and all that stuff.
Exactly right. And so we're through the twisty part of his colon. I'm washing as I go, a little bit of debris, but all in all, very, very cleaned out. So the scope has a water jet and a suction port on it that let us clean up anything that's left. You can see he's got a very good prep, just minimal little debris that easily sucks into the scope. So he's to be commended for his efforts.
I think it's really important. Your message is very clear.
Yeah.
Prevention.
Yeah.
Okay, but I'm also thinking to myself, well, if you're doing it, maybe I should be doing it. And that's in my mind now.
But
that's anxiety of the thought.
absolutely the message. Something that really struck home to me is take a friend with you the first time. Have somebody that's gone through it. Have somebody talk you through it. And that brings you down to a more tolerable or workable nervousness.
Now we're going to start the inspection part of the exam where we look at the mucosa of his colon. Once I feel like I've seen everything under his valve here and otherwise, I'm going to turn the scope around and look at the backs of some of these folds.
And that's where some polyps can actually hide. Now that you see that folding there.
Exactly. So
Well,
now you can see,
good. Looks
yeah,
pretty
isn't that neat? We can see where we came from. That's the scope. The end of it is turned around like a candy cane and looking back at itself.
Wow.
And so I can come back here and look at the backs of all these folds, looking for those flat polyps or any other polyps.
You shouldn't be that nervous about it. But you can die from it. So you just have to figure out how to suck it up and do it. Whether it's taking a friend or just booking it so that it's booked and you can't change it.
Or a
Just do
camera
it.
crew.
And a camera crew doesn't hurt either.
Can't get out of it once you're there.
Oh, right.
The rest of this procedure will look a lot like this, where I look around the inside of each fold for any abnormalities. Polyps can be little or big, and they can hide behind any of these.
So he's had some health issues in the past. I think he mentioned that he was checking for Crohn's and things like that.
So far, he has no evidence of Crohn's disease or ulcerative colitis, which are the two big branches of inflammatory bowel disease that we look for. I actually just found a little polyp. So you can see right at the 3 o'clock position, there's a little bump.
Oh yeah, yep.
And so these are biopsy forceps, and we're going to go in with these through the scope and grab that polyp in one bite. So there's the forceps coming out the other end. Open,
Yeah.
please. So getting a good look at where we were. Close. So you can see there's a little
Wow.
crater left where that was, and
is
it's gone now.
fascinating. So you just ripped the polyp off like
Yeah,
that.
well, and it looked like a rip, but really the jaws of the forceps are like a razor, and so it's a clean cut.
Yeah.
There's nothing left, and we can look back where we were and make sure that I didn't miss anything, and there's a little crater left where it was. He won't feel that at all.
Okay.
He didn't have any pain when we did it, and he won't have any pain when he wakes up.
That's great.
Dr. Maxwell has just found a polyp in Brian's colon. After the break, we'll find out if it's something to worry about, and we'll see the rest of Brian's colonoscopy, all here on The Younger You. Be sure to check out the Younger You website to watch full episodes of the show. Stay up to date on the Younger You Challenge and get useful tips and tricks to help you achieve the Younger You. Before the break, we watched as Dr. Maxwell discovered a polyp in Brian's colon. Let's check back in with Dr. Red and Dr. Maxwell to see if this is a cause for concern. The following footage contains actual medical procedures. It may be too graphic for some viewers.
So now that you've taken off the polyp, what happens then?
So that polyp will go to a pathologist. Mark put it in a bottle, and the pathologist will section it and stain it, and they'll tell us what the polyp was. Was it a precancerous polyp, like an adenoma? It could be a lymphoid aggregate, just a group of lymph cells, or a reactive or inflammatory polyp. Most polyps fall into one of those categories, and then based on that, we'll decide when he needs another colonoscopy. There's a little mucosal abnormality here. I think we'll go ahead and take it off. It's unlikely to be anything big, but we're here already.
So that looks just like the polyp. How do you tell the difference between that and a typical polyp?
So I can't tell the difference. You know, looking at it through the screen, I can't tell what it's going to be.
Yeah.
And so when I take it off, I take it off for the pathologist to make the decision. Okay. Open, please. Close. Thank you. Have that.
Looks like a fluorescent yellow.
That's the prep that he drank. I guess I don't know what color Gatorade he drank, but if someone drank blue Gatorade, it'll be fluorescent blue.
Will it?
Yeah. So we're just about out. We're down into the sigmoid colon now, and I'm suctioning out the little bit of liquid that's left here while I go back and forth inspecting for changes, but everything looks great.
So is it normal for people to snore like he's snoring right now?
Oh yeah, a little bit.
That means he's in a good deep sleep right now. That's probably
Yeah,
good, right?
he's, he's done great. He's breathed very well. His oxygen saturation's been perfect. His blood pressure looks good. He's had a really easy procedure. We're just about done. I don't know that we're much more likely to find anything here on the way out as anywhere else, but maybe. Actually, there's another polyp.
Yep.
Let's see. Okay, open please. So the goal here has got to be to get that out in one fell swoop. Close. Good.
How long did it take you to get that good?
You know, colonoscopy is actually somehow a lot harder than it looks. That part where you take out the polyps, that part's kind of like playing video games. The hard part is getting in and getting all the way around with the scope in short position.
Yeah.
So that you can do a good exam on the way out. And that took a long time. That took, you know, probably a couple thousand procedures before I felt really, really comfortable.
Going in and maneuvering.
Yeah, comfortable enough to be on TV doing it, for example. All right, we're at the very end now, looking through the remainder of his rectum, and everything looks great. So now I've turned the scope around. This is called retroflexion again in the rectum. Looking at the way out to make sure that there are no bad hemorrhoid disease or anal cancer or anything like that, and this all looks great. And we're all done. I'm gonna suck out a little bit of air for Brian's comfort. And that's it.
Right. So Dr. Maxwell, we're done. We found a couple polyps. You'll send them off to pathology. Now, what else will you do there?
Right. So that was a very typical colonoscopy. Brian had an easy time. We found a few little polyps. I don't know what the polyps will be, so we send them to the pathologist, who again will look at them under the microscope and decide do they have any precancerous potential. And based on that information, I'll turn that around and talk to Brian about when he needs another colonoscopy.
What's his recovery time like now?
He'll be waking up here in the next 5 minutes, and he'll be a little groggy for about 25 minutes, and then he'll feel remarkably well and be able to walk out on his own.
All right, Dr. Maxwell, look forward to seeing you when we're back in town.
Thank you very much.
Alrighty, take care.
Well, Dr. Red, you were in the hospital with Dr. Maxwell, who actually performed the procedure on Brian. How did it all go?
It went really well, and all the guys out there that worry about having a colonoscopy, they don't need to worry.
Well, why do they worry?
I think, you know, just for the regular reasons, there's lots of things to worry about. But it went really smooth, and Dr. Maxwell did a great job. He obviously he's an expert at it, but it went smooth. It was great.
Okay, great. So he removed 3 polyps, I see, from Brian.
Yeah, you know.
Tell me about that.
This is interesting. He removed 1 cancerous polyp, precancerous polyps. Yeah, and he also removed 2 benign polyps. These are non-cancerous. But it just goes to show you how important it is to get a colonoscopy. Okay. Because had he not found that precancerous polyp could have turned into a lot bigger issues.
And because Brian has family history, hence why we were doing these procedures on him as well. Can you actually explain, in layman's terms, what is a polyp?
Yeah, so a polyp, if you think about it, and Dr. Maxwell said this good, it's like a growth on the skin, except it's inside the intestinal lining. Okay. And so kind of the same similar thing. It's, you know, if you look at a little growth or even a little freckle, that's what a polyp is.
Okay, is it, when I say normal, I hate using that word because I don't like to be defined in that way. Is it normal for people to have polyps?
Well, you can have about 50% of patients will end up having polyps. And so, you know, it's common to see them, but, you know, obviously the chances decrease when you end up talking about precancerous polyps.
Is it necessary for concern?
Yeah, because if it is precancerous, then it can lead to a lot of bigger problems.
In your practice, what do you look at when you're viewing a colonoscopy?
The biggest thing that we're looking for is to see if there's any type of intestinal inflammation. We're also looking to have them do biopsies for celiac disease, looking to see if there's any other autoimmune diseases as well. Obviously, we want to make sure if someone's coming into our office with significant intestinal problems, we want to make sure there isn't any type of cancerous tumors or other problems like that could be caused.
Okay, so of course you work with a lot of IBS, celiac issues. What are some of the concerns regarding all of that?
With all this, we know that increases the risk of having colon cancer, but most importantly, it's just caused a lot of discomfort for a lot of patients. And oftentimes this goes mismanaged, and not too many doctors know how to actually get this problem functioning better. And so we have a lot of patients with serious constipation or other bowel problems with a lot of intestinal pain and bloating and just...
Well, what are you doing about that? How do you help them?
Well, the biggest thing is we take more of a microbial view where we're trying to go in and see, okay, how's the flora, how's the bacteria, also looking to see if that patient has food intolerances. There's a lot of other physiological problems like autoimmune diseases, cortisol defects that will in turn cause IBS as well. And so really trying to pinpoint the exact problems and areas of concern and then working to improve those areas. This will allow these patients to go from having a lot of symptoms to feeling a lot better.
Okay, well, I must say, after watching everything that Brian's gone through and actually having a good result, what is the one thing that you would be telling everyone out there who are watching, the guys and their wives, okay?
Yeah.
What would you be saying to them?
Yeah, I mean, if you have a history of this or you're over the age of 50, I would get this done, no question. It was really non-invasive. It wasn't that big of a problem for Brian. Dr. Maxwell did a phenomenal job. It was actually a pretty pleasant experience. It wasn't too bad. So.
Well, it says you were just standing in the room. But anyway, thanks for watching. For more information about the show, please visit our website at theyoungeryou.tv, and we'll see you next week. Eyelids droop because of genetics and age. Next week, we'll meet Sandy, a woman who decided it was time to open her eyes and get her eyelids lifted. Next week on The Younger You. The Younger You set provided by Madison McCord Interiors.